Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Patients in mental health care may be at increased risk for demonstrating unhealthy coping mechanisms or inappropriate responses to distress. When your 52-year-old patient is angry with you for not making a medication change she requested, which of the following would be characterized as a passive-aggressive response? A. Glaring at you for the rest of the visit and responding to every question with, "You don't listen to me, so why do you ask?" Or B. Loudly complaining to you and other people in the waiting room that you don't know what you are doing. C. Purposely missing her next appointment without calling to change or cancel. Or D. Telling you that she refuses to take any medication if you will not consider her input. So, again, let's focus on what the question is asking. The patient is angry with you. Which of those would be characterized as a passive-aggressive response? And remember, by definition, passive-aggressive is an aggressive action, but not directed at the recipient specifically. It's a lateral aggressive response. So, C is the correct answer. Passive-aggressive behavior, like I just said, is characterized by the patient doing something negative without confronting you directly, without confronting you or the intended recipient directly. I mean, that's a key phrase here, a key feature of passive-aggressive. All of the other choices, while inappropriate, are not passive. So A, glaring at you for the rest of the visit and responding to every question with, "You don't listen to me, so why do you ask?" It is an immature response. You wouldn't necessarily expect it of a 52-year-old, but it's not a passive one. It's being directed to you, the source of anger. So while it's not necessarily what we would hope for in the response of a well-adjusted individual, it's not a passive-aggressive one. Similarly, B is highly dramatic, loudly complaining to you and other people in the waiting room that you don't know what you're doing. Again, highly dramatic, inappropriate for a 52-year-old patient. I mean, you might expect that from a 12-year-old, but not a 52-year-old. And something like this highly dramatic response may be characteristic of a personality disorder or some other deviation from health, but it's not passive. And then similarly, D is not passive and, not an unusual initial response. Telling you that she refuses to take any medication if you will not consider her input. Again, it's directed at the recipient, so it's not passive. And, honestly, it's not altogether unexpected if the patient has asked you about a medication change. Maybe she Googled it, which so many do these days, comes to you and says, "I Googled this and, can you change my medication to that?" Just a no, just a no is probably not the best approach. I mean, the days of the very paternalistic, "I am expert, you are uninformed patient, you must do what I say." This is over. If you just say no, it's a good idea to follow it up with why. Acknowledge the patient as an adult has come to you with a request, offered a suggestion, and it may not be the right intervention. I'm certainly not suggesting that we should just change medications every time a patient asks us to. But if you're going to say no to any request to another adult, customarily you get the best response by giving a rationalization. This medication is not appropriate for you because I know Google says it works in this circumstance, but frankly, it doesn't. Or this medication is not appropriate for you because of your comorbidities. Or this medication is not appropriate for you because you've demonstrated adverse effects to other similar medications, like any one of a bazillion reasons. But just giving somebody the reason might then be enough. Well, okay, thanks for explaining it. It just looked like a good option, but I see it's not there. So anyway, I digress into communication skills, which frankly are not my strong suit, but just in dealing with any patient, you're more likely to get an optimal response if you tell them why the answer is no. However, coming back to this question and what it's asking of you, this question is really designed to ensure that you know what a passive aggressive response is. Passive aggressive is a term that's very commonly used in the lay population or just in general conversation, often inappropriately by people who don't really know what they're talking about. And so we, as the professional, definitely need to recognize what a true passive aggressive response is. And again, there is some level of aggression or displeasure that is demonstrated, but it is not to the recipient. It's on the other end. And so the best answer here, C, purposely missing or her next appointment without calling to change or cancel, that's passive aggressive. The patient has never confronted you directly with her displeasure, but just missing the appointment, not showing up, not calling the change. It's a negative thing, and that's your best answer choice here with respect to passive aggressive behavior.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.